It's my pleasure to introduce the women of our panel today. These are the women you went to school with. These are the women who live next door to you. These are the women you work with. These are the women you meet in the waiting room. It takes a lot of courage to share your very personal, very intimate stories of your life with a group of people you have never met before, as is the case today. This isn't easy, but I want you to listen very carefully to their stories. This is the stuff you cannot learn from your textbooks and from grand rounds. What we're going to do is have each of the women tell their story. I've asked them to try to be succinct and to focus on those quality of life issues, aspects that they most want you to know when you leave here today. That should give us time for a lot of questions at the end of each of their stories. And I really encourage you to ask questions. The women will want you to seek clarity or to go a little bit deeper. If we're uncomfortable, we'll let you know. Okay? So our first speaker is Shelly Mountain from Prince Edward Island.
Hi, everybody. Eleanor Roosevelt said it best. You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. It's so great to finally be here. I've been dreaming about an opportunity like this for a very long time. My chapter national can attest to that. But why was I chosen to speak to you today? Why am I here? I'm here because I have von Willebrand disease. I have been traveling through life trying to figure out who I was and how I fit in as a woman. When I was in grade 7, I used to hide my maxi pads in a pencil case. Mind you, back then they were these heavy, thick pads, back in the 80s. I had left the classroom to go to the washroom, and when I returned, the kids in the class had taken them out of the pencil case and taped them all over the classroom with words written on them. They put them on the chalkboard, on the floor, on the desk, everywhere. That was a defining moment in my life. At that moment, I knew I needed to know why I was different. Why did I bleed differently than my mom? Were there other girls' periods this terrible? Did they really bleed this much? There had to be a reason. I did find out several years later, and it has changed my life. And this is why I am here. I'm here because I had a choice. I made a choice a long time ago to confront my bleeding disorder, not just exist with it, and advocate for me. Who else was going to do it? When my youngest daughter came along, who also inherited von Willebrand, I made a choice to be an advocate for her. Now I'm making the choice to show you how great life can be living with a bleeding disorder. I alone can accomplish anything and everything I choose. I'm here because I have confidence. I spent the first 19 years of my life alone and feeling different, almost like I didn't fit in as a normal woman. It took many years to find that confidence and self-esteem. Periods, anemia, ovarian cyst, weight issues, surgeries, all of it took its toll. When I found out I had VWD, I finally had an answer. As a woman with a bleeding disorder, I wasn't alone, and there were many more like me. I gained the confidence to speak up and ask questions about my bleeding disorder. Knowing I could make a difference in other women's lives, as well as my daughter's, has been my therapy. I'm here because I have knowledge. I've learned from my past mistakes. Maybe I didn't ask the right questions, maybe I didn't know any better. When I was 19, I was a single mom with a new baby, my eldest daughter, and finally discovering a name for my bleeding disorder. I didn't understand. So through the years, I gained the knowledge through self-discovery and self-awareness. Who knows their own body better than you do? I want the knowledge to be able to give my daughter a great life with a bleeding disorder and also be there for her with her questions about being a woman and to give her encouragement and love. I'm here because I have strength. I gained strength from every obstacle that came my way. Through the heavy periods that affected my youth, hemorrhaging with my 2 childbirths, hysterectomy at age 30, and surgery to remove my ovaries just this past fall. In all these situations, I grew stronger, and the challenges gave me the strength to continue living my life to its full potential. I'm here because I have support and love. In 1994, a hematologist asked the right questions and gave us a name to our bleeding disorder after so many years of not knowing. Then in 2007, I discovered the CHS, the PI chapter, and all the support and love from across Canada. So many people have touched our lives, and in return, we shared our story about our life's challenges of living with a bleeding disorder. Where would we be without support and love? It's a question I so understand now. It's a question I'll pass on to my children, and so on. I'm here because I stood up for my quality of life. There's no one to advocate for you than you. Would you not want to know you have the best care available to you? In every challenge I faced with my bleeding disorder, I stood up for myself. My physical health, my mental health, my stress, my work, my relationships, self-esteem have all improved once I understood the kind of life I deserved. Sometimes we need to stop and understand that quality of life is our key to well-being and inner peace. I'm here because I have found happiness in me. Finally, I'm proud to say I'm happy in my life. I love who I am, who I'm becoming every day, and what the future holds. What a better way to inspire my daughter and women. Being able to show them a strong person that has inner peace, happiness, and control of her life. After so many years of being alone, I realize I'm not alone, but one of many who can bring happiness to others. Oprah Winfrey said it best, "I'm a woman in process. I'm just trying like everybody else. I try to make every conflict, every experience, and learn from it. Life is never dull." I'm here to fight for a better life. I'm here to stand for my daughter, who also has von Willebrand disease, for the undiagnosed women and girls in Canada and around the world. For those women who are diagnosed, such as mothers, sisters, and aunts, I'm here for the husbands, the fathers, the brothers, the uncles who stand by us women every day of our life. To all the medical professionals who stand by us, trying to give us a better quality of life, and I'm here for me. So why did I inherit this gene that caused von Willebrand disease? It must have been in the master plan. So I could make the choice, have the confidence, the knowledge, the strength, the support, and the love, and believe in that quality of life, and have the happiness in the person who stands before you all today. So now I'll ask you, why are you all here? And what will you take back with you?
So our next speaker should be Clara Penner from Alberta. Clara's father passed away earlier this week, and Clara, of course, is where she should be today. She's at home with her family. And so late last night, Clara sent along her story, and she asked that we would read it on her behalf. I've read through it a couple of times, so forgive me if I'm stumbling a little bit on some of Clara's wording, but for those of you who know Clara, imagine Clara up here. Everyone has their own personal stories of living with a bleeding disorder, and I'm sure that many of the stories are similar, all ending with the hope that we will continue to provide more care to improve the quality of life of all people affected with bleeding disorders. Awareness and compassion for women with bleeding disorders is a great start. Since the treatment is available for bleeding episodes, the awareness, compassion, and realizing the impact on women, we can make the treatment more available and give all people better quality of life. As a little girl, the first memory that I have is the hours I would spend almost daily tending to my nosebleeds. The typical time frame for each nosebleed was 45 minutes of pouring blood, not a trickle. As I turned into a teenager and began my monthly cycle, and as my nosebleeds continued, I felt continually drained. Being aware of the effects of the extreme loss of blood during each monthly cycle and how much that impacted my quality of life. In my case, I found the exhaustion from being continually low in iron to be my biggest hurdle on an ongoing basis, as well as it had an effect on the concentration in school. Either the pain or the exhaustion constantly interrupted me. My periods lasted for about 10 days a month, 8 of those being very, very heavy. I'd have to wake up every hour during the night to minimize overflow. It was difficult to participate in activities and trips since I needed to be near a washroom at all times. I never understood that this was not normal. as we do not talk about these things with others. Awareness is key. My health became so impacted because of the extreme bleeding patterns and lack of treatment that I became very ill by age 28. I chose to have a uterine ablation at 35. Since then, along with being very health conscious, I've regained much of my health. The difference in my life, just by controlling my monthly cycles, is absolutely amazing. As I grew up, I did suffer through many joint bleeds that were untreated because no one would recognize that even though I only had 12% factor, that bleeding was a possibility. Tiring of the constant fight for treatment and being treated poorly, I just gave up and no longer acknowledged my bleeding disorder until I was expecting my first child. During that birth, I almost bled to death. My son was diagnosed at birth with hemophilia A. As any mother does, I immersed myself in learning everything I could to help my son. And with this knowledge, I also learned how to help myself. However, it is a struggle for the medical community to administer proper treatment for me at times. But I am grateful for how far we have come and how we continue to become more conscious. My daughter is now 11 and is a carrier of hemophilia. I have always been very watchful for any bleeding periods that she presented. My goal is to provide her with the awareness and treatments so that she will be able to avoid many of the situations that I have learned from. It is my belief that by becoming more aware of the impact of the quality of life for women affected by bleeding disorders and providing women the treatment they need, that we will continually improve the quality of life for everyone. And she goes on to say, thank you very much for the opportunity to share her story. So we're all thinking of Clara and Clara's family today. Next, I want to introduce Beverly Dawson. Beverly is from New Brunswick.
Hi, my name is Beverly Dawson. I'm from Moncton, New Brunswick. I have Glanzmann's thrombasthenia, so I'm one of the 24 women approximately across Canada who have this disorder. What makes us unique makes us special, right? I was diagnosed at the age of 2 months, and I suppose I was one of the lucky ones, or I consider myself to be lucky because I was born in Moncton, and there one of your colleagues, Sheldon Rubin, was consulted after my pediatrician noticed that my mom, when she was changing my diapers, I would continuously have bruises around my ankles. And he thought it was peculiar, and of course back in 1977 might have triggered a few alarms because the bleeding community and the bleeding disorders weren't well known. But he referred immediately to a hematologist, and Dr. Rubin, I believe I was one of the first patients to have Glanzmann's thrombasthenia. The difficulty with living with that disease, I have to take stories from my mother because she talks often about the painstaking of watching me learn to walk and walk again and bump and bruise and fall on the floor. We even had a little special helmet made for me so that I would prevent from hitting my head. But then those years, of course, I don't remember. That was my mother's story. But what I start to remember is the years going through school. So as you start kindergarten and grade 1, and you have to start to explain to your friends why you have a black eye that day and why your nose is bleeding, why your teeth fell out and you suddenly have all this mouthful of blood at school and you have to be sent home. Those were the stories, or those are the memories that I have from living with a rare bleeding disorder and trying to explain to your teachers and your classmates that you have hemophilia for girls rather than Glanzmann's thrombasthenia, because back then there was no iPhone or Wikipedia to Google really quickly, is she lying? So hemophilia for girls was basically my little tagline to try to explain what was happening to me. The Hemophilia Treatment Center was basically my savior for most of my life. They supported me both physically through periods of anemia, continuous iron transfusions that I get, but also for the emotional as well. And maybe this is where we're supposed to talk about our quality of life and how the emotional part takes over. It's very difficult as a teenager to grab a concept of with a rare bleeding disorder such as mine and no available treatment except platelets, that you will never have kids. You probably shouldn't get pregnant. You should, try to live your life, not in a bubble per se, but don't be too adventurous and don't try to take too many risks and, don't go to gym at school and hence obesity happens. So the support, the emotional support that the treatment center gave me was instrumental. And whenever there was a trauma, I had to have, dental extractions ×3. I had tonsil bleeds. And these all happened during periods of high stress as well. So if I was transitioning to high school or if I was transitioning to college or university, it seems that my bleeding episodes would get worse. Even my periods would get worse around those sets of times. So that treatment center and all my nurses and my hematologists, they really helped me out through that. My outlook on my future, basically to prepare for the real world, I don't know if this is something that was set inside of me, but I thought, well, the best place for me to be, because I'm so rare, is to maybe be closer to the emergency room as possible. So I did strive to become a pharmacist, and I'm a pharmacist at the emergency room at the George Dumont Hospital in Moncton. I'm very often the little voice that whispers behind the ER doc, by the way, could you check them for... If we do have same patients coming in time after time for heavy periods and wanting, notes off work or, increasing their birth control pills or doubling up or tripling up their birth control pills, thinking it's an estrogen issue and not a bleeding issue. So I'm often the little voice at the background. But it did impact my life in a positive way, and I'm trying to put a positive spin on having such a rare disorder and having such a rare diagnosis. So always staying one step ahead is basically my mom's motto for me. So if I knew as a teenager I was going to go out and drink with my friends, make sure that you don't get into a car with someone who drives and make sure you don't fall down a hill. And there is no difference between 2.5 ounces of cheap red wine and expensive red wine. They still make you bleed the same. I'm sorry, I'm ad-libbing a lot because it's overwhelming to actually be able to tell my story to you all, because it's, like I said, a rare opportunity and a rare disorder to try to share with all of you. And there's so many little stories that I could tell you about. The important thing I want to put through, though, is having this disorder is what gave me my drive. And what this drive is that I want to be frontline. I want to be educating. I'm not letting the fear of having an accident prevent me from having, higher education. I'm actually doing my doctorate right now in pharmacy studies through Colorado. I want to go further and I want to teach. So if anything I can teach the ambassadors, I'm trying to teach everybody in the room, but if the ambassadors can take anything away from this, is that don't let anything like a bleeding disorder diagnosis stop you from achieving goals that, perhaps you may not think are attainable at the time, especially in young children. So yes, they can go on to university, and yes, they can become doctors, and maybe they'll want to be hematologists. The thought did cross my mind, but I have a fear of blood. So what I last want to leave you with is basically an early diagnosis leads to early acceptance in the patient. So I know you guys speak of the 16-year span before somebody comes in with menarche and all of a sudden has heavy bleeding, but even noticing the bumps and bruises and scrapes as a child, or the teeth falling out at a young age and growing back in, and the accidents, those little things, I think in the emergency room, as a frontline physician, as a family physician, that early diagnosis is going to have so much of a greater impact than just, treating them later on in life. And the early acceptance as a patient is what's going to move them to educating others. And that's very apparent with our ambassadors here today. They want to go forward and educate others to try to get that diagnosis done as early as possible. So thank you.
Thanks, Beverly. Thanks. Our next speaker is Katie Cunningham, also from New Brunswick.
I'll stay here. Do you want to sit?
Yeah. I think of myself as a pretty average 18-year-old girl. I go to university, I have friends, a boyfriend, and a full-time job for the summer. Except I'm not completely average, because there's a reason I'm here. I have type 1 von Willebrand disease. I was diagnosed with type 1 von Willebrand disease in 2008. Up to that date, I wasn't sure why I bruised so easily, bled longer when cut, and had heavy menstrual periods. I was glad when I was finally diagnosed, because I learned how to control my bleeding to lead an active and healthy life. Personally, I don't really notice that I have a bleeding disorder most of the time. And I know that's not really what I'm supposed to say, because I'm here to talk about the quality of life while living with a bleeding disorder. Maybe I'm just confident and don't like to think that something's medically wrong with me all the time. Or maybe, and most probably, I'm just used to the routines I take. What's normal for me isn't normal for everyone else, but I don't realize that because it's normal for me. But as long as my blood stays inside me, having a bleeding disorder doesn't really play a huge role in my life. It's when my blood doesn't stay inside me that having von Willebrand disease comes a little more prominent. Nosebleeds are a completely different aspect when you have a bleeding disorder. Although nosebleeds can be common with many bleeding disorders, I only get them every once in a while, and trust me, I'm not complaining about that. Because it's not normal when you get sent home from school because you had a nosebleed in class that wouldn't stop for over half an hour. And it also isn't fun when you get a nosebleed on the bus coming home from school and you don't have any Kleenexes with you. What is a common occurrence, and in fact a monthly occurrence, are my heavy menstrual periods. Of course, those are more bi-weekly when I don't control them properly. This is the way my life has been impacted most by having von Willebrand disease. The first time I had my period, my mom was away, which would have been horrible for any normal girl becoming a woman for the first time. For me, it was the worst 10 days of my life. I bled so much that I couldn't go to school, and every time I stood up, I had to run to the bathroom. Now I control my periods by taking the birth control pill and cyclocapron during the week of my period. Within the last 4 years, I've had 3 mouth surgeries, which should have been no big deal, but of course they were. The first one was the extraction of my wisdom teeth. I had to get injected with DDAVP before the surgery to help my blood clot. The bleeding during the surgery wasn't the problem, but more the medication I had after. Of course, they wanted to give me Advil and ASAs that I couldn't take, so eventually I convinced them to give me Tylenol 3 for the pain. But I was allergic to that, and I didn't know that. So I kind of vomited for a week after with a swollen mouth, and that can't be directly related to having von Willebrand disease, but I had to take that medication because I couldn't take anything else. The next 2 surgeries were simple gum graftings. Normally it could have been 1 surgery, but because of the extra bleeding and more time to heal, the doctor thought it would be best to do 2. I was to receive DDAVP again before the surgeries, and I did, except the pharmacist messed up the concentration for the first one, and I was injected with way too much. My body couldn't absorb the medication, and I bled so much the doctor got worried and had to stop. However, everything was fixed with second surgery, and everything went back better. But dentists still aren't a huge fan of me because my gums bleed so frequently during checkups. The most common and mildest form in which von Willebrand disease affects me is the easy bruising. I run into tables and other furniture all the time, and where anyone else wouldn't have a mark left on them, I get nice green or yellow or blue, any color bruises. I used to work at Shoppers Drug Mart, and sometimes I had to refill the milk in the refrigerators. The cartons of milk are pretty heavy, and they come in crates, so for a girl like me, they are pretty heavy. As I carry the crates, I kind of lift up my legs to the bottom of the crate to help support the weight. I had to stop doing that one day because I wore shorts, and I noticed these big streaks of bruises going down my thighs from lifting those crates. And nothing beats the time I was hit in the forehead with a baseball. That left a massive bruise that stayed there for weeks. I may act confident and act like having von Willebrand disease isn't a big deal now, but the truth is I'm quite afraid for my future and when I decide to have children. I've heard horror stories about other women having von Willebrand disease, having miscarriages and sometimes heavy breathing after childbirth. But I'm lucky to be as well off as I am, and all I can do is plan my pregnancies and be aware of medical treatments that may be available to help me carry any babies to term. Overall, I'm an average person that doesn't let von Willebrand slow me down, but I still have to be aware of it. The only thing different about me on the outside, other than the more than occasional bruise, is my medical alert bracelet that I wear just in case.
Thank you, Katie. And last, but certainly not least, we have Karen Fahy from Quebec.
I'm so pleased to be here today, and I'm as pleased to have the opportunity to share with you all some of my experiences with living with a Factor VII inherited bleeding disorder. I'm a little bit nervous, like most of us are here, because when you talk about things that are personal to you, it reminds you of the difficulties that you had. Living with a bleeding disorder, you move forward and you want to forget about the incidents in the past. So I'm going to attempt to bring forward some key points that I really want to drive my message home on. My first diagnosis was at the age of 8 years old, and I really only began to feel the effects of my bleeding disorder when I began to have my menstrual periods, which was around the age of 14. That's really where my journey begins. As we prepared for this conference, I was asked to think about how my life was affected by this bleeding disorder. Trust me, I had a lot of stories that were going through my head. I'm like, where am I going to start? Growing up, my environment basically consisted of little access to information and resources to help me cope and receive adequate care. But as I prepared for this conference, 4 key points stand out to me, which I feel sums up my quality of life and the experiences I've had. Fatigue, lack of confidence, anger, and why bother. As it relates to fatigue, as a result of having excessive monthly periods, my energy kept draining away. Even though I would take iron supplements on occasion to help, I basically could not build up my energy level to a point where I felt good enough to get out of bed, work 10-hour days, travel for business, tend to the kids, and try to be a good wife, all the while dealing with my monthly periods, which would last 10 to 14 days. I would need to wear 3 maxi pads, a tampon, and trust me, if I could have put 5 on, I would have put 5 tampons, but that virtually was impossible. As I would walk, I would forever be self-conscious, wondering if my excessive padding was noticeable, worried if it shifted, and I might have an accident in the office. I should interject and say that I work in the world of occupational health and safety, a world that is industrial and commercial based, and I'm surrounded by men. So it would be very hard for me to go up to a colleague and ask if they had a spare tampon or maxi pad. So, and my equipment would have to be changed on occasion about every hour, hour and a half. So you can imagine how this interruption would affect my work routine and my performance. How my confidence was affected. I've had to deal with so many mishaps in the worst of places, and trust me, we'd be here till tomorrow if I shared all the stories with you. Drained of energy, changing moods, difficulty coping, dealing with comments from colleagues asking me why I was going to the bathroom so much. When you'd wear a skirt, why do I have so many bruises on my legs? Once a month, trying to adapt my life around my circumstances. All this over time and over the years, chipping away at me. My confidence started to slip away, and insecurity would set in and affect me in many ways. But certainly, the greatest impact was felt at work, where I spent much of my time, and at home, where in essence, I would unload. My girls and husband have shared with me that there were times it was hard to share their life with me and share their life with my bleeding disorder. It was hard for them when I would simply choose to isolate and go down in my room and just try to regroup, looking to find the energy to start the next day all over again. Why bother? Over time, I would try to communicate what was going on with me on many occasions, often told, yeah, some women bleed a little more than usual, that's normal. My mom would tell me, as I grew up, would tell me, be more careful and you won't have accidents. I quite simply felt like I wasn't heard. At times, actually asking myself and wondering, am I the problem here? Maybe, there's something I'm not doing properly. I would tire from having to explain my situation over and over again. I would tire to have to bring my purple file to St. Justin's Hospital to show them, the historical impact of what I've been going through. And I would tire over finding no resolve and no direction and no relief in sight. So I would say, why bother? My last point is anger. As I approached my 40s, I came upon actually a godsend, the St. Justin's hematologist department, and I was very lucky to have met Dr. Francoeur and Dr. Winikoff, and their teams. Finally, I could communicate and feel understood. They would work with me to find ways to reduce the effects of my bleeding and look to improve the quality of my life. I was simply elated. Unfortunately, for several reasons, and it's a long story, and I was told I only have 5 minutes, I had to undergo a hysterectomy. I was concerned at first, of course, knowing I had this disorder and knew that there were risks. However, I was reassured by everyone that the necessary care and precautions were to be taken and to ensure for a successful outcome. Well, that wasn't the case. There were a couple complications after I was sent home for the final stage of recovery from my hysterectomy, and shortly upon my arrival home, I noticed a bleed, and a whole series of events led to another surgery and a transfusion. But during that whole process, I found myself basically fighting for my life, having to tell my story and try to be understood upon my admission at the hospital. My husband never felt secure enough or informed enough to communicate any necessary details. And so the responsibility to communicate fell upon me, even though I wasn't in tip-top shape. My recovery took months, in fact years to be quite frank. As I prepared to go back to work, I have to say anger and frustration set in because I knew I had a big job to go back to. I did not have the level of concentration that I used to have, did not have the energy that I used to have, and I had to deal with work. I went through something that I felt that I didn't need to go through that was so extreme, and it frustrated me. And my recovery was slow. It really took some time for me to get over the anger and frustration, and trust me, my anger and frustration was directed in many areas. Why me? Why couldn't my husband do the talking? Frustrated with him, why couldn't he take the time to show the necessary attention? I couldn't understand. In reality, he was as fearful as I was and didn't want to miscommunicate any detail and put me in a worse situation. I have to say that over time and over years, my energy slowly came back. And as my energy came back, not having to deal with a period anymore, because I had had the hysterectomy, my confidence started to build. And I started to forge forward in life. And with this honor today, being here sharing my story, I'm committed to do my part in the community and be a voice for other women like me, letting the community know that there are people that want to listen, and there are people that are willing to help, and that there are resources, and they don't need to live a life in isolation. And that's my story.
So you learned a lot. Do you have some questions for us? So the question is that Karen was diagnosed when she was little, but then there seems to be a huge gap in her care and her treatment.
Yeah. I'm not the only one in my family that has a bleeding disorder. It actually goes back to the documented to my grandmother. And yes, indeed, at the age of 8 years old, although we were diagnosed, we were identified as having a bleeding disorder, but they weren't quite sure what it was. And I have to say that over the years, I'm 46 years old, I'm not afraid to say that, I'm accepting of it, but I've had multiple diagnoses over the years, and that in itself has been challenging because you think you're on the right path, you think you understood what's going on, but something else would happen in our life. And I say our lives because whether it's me, my brother, or my dad, who also had the disorder, something would derail us and something would redirect us. You get to a point, you're confused, you don't know where to go. My parents were limited in what they were able to do at some point in time. And I really only took on my own files when I started to really have children. So that kind of triggered a whole different process for me. So basically at the age of 29, 30 is when I started to dig in. So that's why there's a gap. It's really been bumpy of a road, and it's really been a process that wasn't cookie cutter or black and white by no means at all. And I've actually become a resource for my family because I come from a very big Irish family, and there's several of us. And when they have questions or they're not sure, now I get the phone call, and I'm glad to do it for them actually. So to keep them, safe and help them communicate. Really, what we learned, our family, was help them help you. If you have the information, bring it in, bring it forward, and push it forward. So that's why there was a gap.
Okay.
I have a quick question, actually not a question to the panel and to the people in the audience. Recently I found out that, that surprisingly that one of the food sources, because we mentioned anemia, that contains the most iron is not blood pudding or boudin in Quebec or a liver, but does anybody have any ideas? No, it's actually the cheap can of clams, the baby clams, and this is because one of my family members recently had a severe case of anemia, and the nutritionist and the surgeons. Clams, for example, 7 milligrams of iron in liver for the same portion. Clams something like 28 milligrams, same portion.
Good to know. More questions?
Thanks very much. I thought it was it's always very interesting to hear from the patients and very powerful, of course. But all of you mentioned symptoms occurring during your school age years, especially, of course, around the time of menarche. Do you remember ever any information in school that you received that give you a clue that your periods may have been different than your classmates? And if not, what sort of information do you think would be good to offer to schoolgirls that maybe they can take home to their family to highlight? Maybe my experience isn't normal, because it's such a huge problem. It'd be hard for us to educate everyone. So maybe if you could have some comments and maybe some suggestions for us.
Yeah. Can I comment on that? For me, growing up, first of all, was you went to the nurse's office and you lied down, and then after that you were either sent back to class or sent home. That's kind of what was happening. My daughter is also a factor 7 deficient. She's 18 years old. So you can imagine our household, all of this and what I do for Cadoge has brought up a lot of conversation, right? So I've asked her a lot of questions about what her life is as a teenager in high school. She indicated to me that in her school, there's nothing being supplied or shared with them on the subject. And she actually became suspicious that some of her girlfriends may have some form of a bleeding disorder. I can assure you that as my role as an ambassador, my first target is that high school and plan to sit down with the nurse and maybe try to arrange for something there to bring the knowledge and the awareness there. But my experience in my little world is that there's really not much being communicated, and I think this is why we're doing this. And this is why we're all committed, and this is why all of the ambassadors are going to step forward and push the information out there to help them.
Katie, not to put you on the spot, but I am. What would you say to that?
I agree that not much is being communicated because I didn't know the difference. Like my first period started like in one of the first days of high school starting for me, and my mom was away, but she has 5 sisters, and they should have known what I should have went through, but they didn't. And I didn't learn anything from school, and I just kind of got like, oh, it's normal, it's your first one, it's gonna be weird. But then it kept being too much, and then eventually my mom got me tested. But I didn't learn anything from school about it. I agree, there's no communication.
I just will comment here that the CHS has done a lot of work, especially with our youth. We have a very active youth committee, and we've been lucky to attract many women with bleeding disorders to that group. And so we have created a video and continually working to see how is the best way to get that messaging out there. Now again, it's in our community, so in a broader perspective, how do we inform young women who are out there? Shelly wants to respond to that, Rochelle, and then we'll get to you.
I have a slightly different story where my father has von Willebrand disease, so I didn't have a mom to talk to. I didn't have a mom that understood. It was very difficult to relate from a daughter, and then the mom But I'm very proud to see the commercials on TV with the different color tampons and the pads that are out there today, like the neon greens and the neon pinks, and you slide it in your pocket. And I'm very proud that we've come so far from going, we don't say pads. We talk about pads now and tampons, and we're free to say that. So I'm actually bringing it to summer camp this year, where I'm going to take the girls and we're going to buy different packs of pads and tampons, and we're going to put water on them to see how much they absorb. So we can share that, you know, this is what a normal soaking of a pad looks like, and this is what's abnormal. But like being outspoken and not being shy anymore is a really powerful tool.
Bev, did you want to respond to that at all?
Because I already had my diagnosis the first day of my period, I was rushed to the emergency room, of course. And I was started on Oval right away, and that was at the age of 12. And so my experience with periods was perhaps a little different. But I do want to encourage more publicity, perhaps, you know, in women's washrooms with the doors closed. This is where, you know, most of us sit there and think of things. Well, maybe there should be a poster there saying what is normal and what is not. It may not be something that high school kids at the age of 12 or 15 want to openly speak about right now, but if you do catch them in those little moments where they can glance over and see, oh, well, yeah, mine is not like that, you know, that might be an area you want to focus on.
Thank you. Rashad?
It's actually a comment. So I think that what I've heard these things before, and so I think that there's 3 levels that we can make a difference in that way. The first is, like you mentioned, the tools, the adolescent video on carriers, and going to reach out on websites and things like that, where teenagers click and Google and Wikipedia and all these other things that Karen taught me recently that I didn't know about. But I think also the other places in the schools, and one of the initiatives that we will undertake in the capacity of Code Rouge with the help of the ambassadors, and it's a proposal, is to go to the school boards across Canada and integrate some sort of bleeding disorder teaching along with the sexual education that they get. And it's very important because very often it's the school nurses that will see the patients, see the children running to the bathroom frequently first, and that's when it's often that's where it should be seen anyways, or that's where people should think about it. And we had a symposium in Montreal as well, and it was aimed at CLC nurses and teachers. And so that's a third way that one of those messages can get out. But I 100% agree. I don't think that it's very integrated at the current time into the curriculum, and it should be.
Thank you. Question at the back?
Very quick, and I'm just wondering if this is a very simple thing. As a gynecologist, I'm always getting these lovely women into my office who are telling me exactly what you guys are saying. Well, this is normal for me, and I'm looking at them going, trust me, I hear a lot of people, that's awful. I'm so sorry that you have to go through that. Let's try and fix this. But we have on a bottle of Tylenol. If you need to take more than 4 of these a day, maybe you should consult your doctor. If you need to use a pad more than once every hour, maybe you should consult a doctor. And putting that on the side of a box of pads would actually be a really simple way of communicating that to women.
And so exactly, we've been working on that with our companies to have a chance to be able to do that. So we're on it.
Hi. First of all, I'd really like to thank all of you for coming up and sharing your stories. That was really great and brave. And I did want to make one comment to you when you were talking about looking at your future, having kids. I have von Willebrands, and I have 3 children who all inherited von Willebrands, and I did have multiple postpartum hemorrhages with them, but honestly, it's very easy to manage, and you're so blessed to already have your diagnosis, and it really isn't a problem. I knew going into it with a diagnosis, and we knew what to do, and everything came out fine, so really, don't worry. I think you'll be in great shape, and I wouldn't hesitate at all. Okay. But what I would like to do is ask you a question. I have 3 kids who are now, I have 2 girls, a 12-year-old and a 16-year-old, and I hemorrhage every month with my period, and I need to infuse with my period. So as I look at my daughters, I question them. I question my daughter about, well, how long is your period? How heavy is it? And I thought I would be able to use like a logbook and kind of keep her privacy so she could just kind of write down how many pads and tampons she's using, and that way I could kind of monitor and kind of work with her in terms of if she needed to use any medication or infuse and kind of track it that way. But being the teenager that she is, she's not very good with maintaining that. So I need to keep kind of asking her questions. Well, how is it now? How often are you changing? And I kind of feel like I need to do this to keep track of it, but at the same time, I'm invading her privacy in a way. And I was just wondering, I think it's wonderful that we have some young women on the panel. And did you ever feel, how do you feel emotionally about that your period is like so public? And did you ever feel like your mom or your doctors are kind of invading your privacy and something that you wish you didn't have to talk about? And emotionally, how did you feel about that?
Well, like now when my mom asks me, because like I've been on the pill for 4 years, like I'm used to it now, like everything's under control. And now when she asks me, I'm kind of like, oh, you're invading my privacy. But when it happened at the time, it was so horrible. I wanted to talk about it, and I needed to. Like, it sounds gross, but my mom didn't believe me. So she would get the pads out of the garbage, and it wasn't until she saw how much I was actually bleeding that she believed me and knew something was wrong to get me tested. But I think that it needs to be talked about in the start, because otherwise I wouldn't know. Like, I could have grown up thinking that was completely normal.
I have an idea for publicity. If you ask Johnson & Johnson or Procter & Gamble for a pad, they can say, we are happy to sell you a lot of pads, but moderation has a better taste, like for alcohol. Then maybe and if it's too much, like too many, like the other woman, the gynecologist said, go consult your physician or health professional. It's an idea like this.
Thank you. The women of Code Rouge and our CHS staff have been working toward that. So I hope very soon that you will see that on those products, and that will help, because it'll be a very intimate way for a woman to be able to see that in the places she needs to see that. I think it's wonderful how we're coming along with the commercials recently. There's been quite a paradigm shift. Remember in the days when you had your period and you bought, sorry to say the name, but if you bought Tampax, you could do all sorts of things: bungee jumping, horseback riding, whitewater rafting. All you had to do was buy that box of Tampax. And a commercial was on maybe, I don't know, a year, 18 months ago, and the woman said, I really don't feel like dancing and twirling when I have my period. And now I notice the other companies are changing their slant. And so I think we're getting there. We're getting there. And we are working with companies like Johnson & Johnson to see what we can do. Yes, sir.
Peter Quitis, Rochester, New York. These are all wonderful suggestions, and I don't mean to deflate the air out of the balloon, but at least in the United States, where we've tried at a national level to raise awareness among manufacturers, companies like this, the pushback we always get is that this is not what people want to hear, because it's just not nice to talk about bleeding. And so that's what we're up against, the stigma. At our own hemophilia center, the local news station was going to do a piece about our research, our center, about women and bleeding disorders, and they spent like half a day. So we figured they were going to do a lot of time on the TV about the show, and we asked them in passing, when is this going to air? And is it going to be at the 6:30 news? Oh no, it's going to be 11 o'clock. People don't want to see all this blood and all this kind of stuff during dinner time. And our problem in the United States, at least, is that we don't have an Oprah Winfrey with VWD. So that's our problem. That we have also tried to approach people like that, to have, the conversation, to have a high, highly visible person. And again, we get this feedback that, this is too gory and it's not something, that should be out there. So I think, the path to take is like you're doing, maybe small incremental steps, and to also, share your successes, with people like us who have not been as successful, across the border.
I cannot resist the comment. Sorry, friends, sorry. But honestly, that's so funny. It really isn't funny. It's very sad. We see the car accidents, we see the shootings, we see all this horrible stuff we're doing to each other in the world, but we don't want to see the blood and talk about women with bleeding problems. We're changing that. Thank you. Mr. Skinner.
Hi. So I'm kind of curious, globally, as we've tried to find ways to reach out and identify women with bleeding disorders, one of the impediments that has become clear to us is the gender of the healthcare professional with which you're speaking. Mm-hmm. That women, particularly in emerging countries, will just not talk to a male doctor about something that intimate. And I'm kind of curious, from your perspectives, whether because most of you mentioned male doctors, at least the name sounded male, that were your clinicians. Does the gender of the profession, of the healthcare professional you're dealing with, affect your ability to discuss this intimately? Are there issues as it relates to the healthcare professional interaction that might make a difference that we could learn from, particularly as we try to carry your experiences on?
Bev, do you want to go first on that?
Well, I work with physicians every day, so there's no communication barrier, whether they're male or female, for me. But I can comment to maybe talking about my periods with my hematologist when I was younger. Perhaps we talked more with the nurse coordinator, who was female, and let her assess the information and present the information to the hematologist. So perhaps there was that avenue where we didn't talk directly with the hematologist about how many pads I was soaking through or how many tampons I was using. But I think there could be some sort of barrier there. Especially, if it's a family physician or if it's the front line, trying to, assess the bleeding in the patient. If it's a gender issue, it could be there.
Shelly?
I agree. I agree with Bev and what she said. I'm a firm believer in if you don't advocate for yourself, nobody else will. So I think our role as ambassadors and physicians and doctors, nurses, is to really teach these women, these young girls growing up, that they need to speak up and they need to say what's wrong. They need to talk about it. So whatever way we can approach that, but letting them know that we have the support and the love for them. So I mean, these girls growing up, we didn't have really the support that we should have had. So we need to really make a difference for the girls, new generation of girls with bleeding disorders, that it's something they can talk about.
Katie or Karen?
For me, I think maybe there is a little bit of an impact there, because I would actually wonder, does he really understand what I'm saying? And it was funny that you said that, because a memory popped into my head when you asked the question, because there was a time at one of my appointments that I actually brought my husband with me, because I wanted the physician to understand what he's going through and that I'm not making this up, that, there's an issue. And believe it or not, I brought him in, and when you commented, I thought, I was looking for credibility. I was looking for someone that could help understand. I felt like, how can they really understand if he's not a woman, So I think, to Shelly's point, women like us have to remain persistent, whether it's a male or female physician. The key thing there is really communication. It's really to communicate, for us to have enough tools to communicate to that said physician what our situation may be, and for us to help them help us, rather than show up at the physician's office and expect them to have all the answers right there in front of us.
Exactly.
We've done a lot of work in CHS as well with other things. Many of you would remember the pain manual that we did, and we talked there about how important communication is. And so if you feel maybe not so competent, maybe English is a second language or whatever language you're working in, Mark, that you have someone who is competent with you to maybe do that. But it's also the way that we speak to our healthcare professionals, and to learn how to keep the stories succinct and to focus on the facts. And so we've done some work already, and I'm sure we will continue to do that, because that's really difficult, not only culturally, but especially culturally. In my respiratory practice, I do have women who come with a son or a husband, and the son or the husband does all the speaking for them. And, so I think here in Canada we have to be acutely aware of that, but share those lessons as we go along with the rest of the world. How do we do this best? And this will be our last question.
So I think it's really important for patients to feel comfortable, and I think some of the gender issues may be that a patient might be more comfortable talking to a female physician. But actually, a lot of times I think maybe the discomfort is on the part of the physicians. And I actually think as doctors, we need to evolve. And that sometimes it's our fault, actually, for not being open and receptive to the information. I mean, there still are male physicians who would rather not talk about this. And so we have work to do on our side as well to try to deal with that issue.